Imagine a society where essential services like healthcare, education, and transportation are readily available to everyone, not just those who can afford them. How does such a system ensure these vital provisions reach every citizen effectively and equitably, moving beyond simple market transactions? In socialist systems, public services are primarily provided through collective ownership and substantial state intervention, with the overarching goal of ensuring equitable access for all citizens rather than focusing on profit generation. This approach seeks to depoliticize basic necessities and treat them as fundamental human rights. The core reason for this approach lies in the fundamental socialist principle of social ownership of the means of production and the belief in economic planning to meet societal needs. Rather than allowing market forces to dictate availability and price, socialist systems utilize various mechanisms to ensure that public services are allocated based on need. This can manifest differently across various socialist models, from extensive nationalization and central planning in state socialist economies to robust public utilities and welfare states in democratic socialist frameworks, sometimes incorporating market mechanisms under public oversight in market socialism. This commitment translates into practical provision methods. For instance, healthcare is often managed through a national health service, funded by taxation, offering universal coverage. Education from primary school through higher learning is typically publicly funded and administered. Essential infrastructure like public transportation, utilities such as electricity and water, and even social housing are often operated by state-owned enterprises or municipal authorities, ensuring broad access and affordability. Decisions about resource allocation and service expansion are often made through deliberative planning processes, aiming for efficiency and social benefit. One intriguing aspect is the concept of social dividends or universal provision, which treats public services not merely as state handouts but as collective benefits derived from societal wealth. This implies a deeper commitment to the idea that everyone is entitled to a certain standard of living and access to vital resources. These systems often aim to eliminate user fees at the point of service, reducing financial barriers and ensuring that income level does not determine access to quality care or education. Ultimately, the provision of public services in socialist systems reflects a foundational commitment to collective well-being and social equity. By prioritizing human needs over private gain and employing various forms of social ownership and planning, these systems strive to build a society where essential services are a shared entitlement, fostering a more stable and just environment for all.